STDs, sexual transmitted diseases. Genital herpes, syphilis, gonorrhea, chlamydia, all on the rise, not just in the Philippines, but all of Southeast Asia. Watch the video, you're going to pick up some great tips, and I will catch you on the other side of the video.
Welcome to another video. Today we are going to discuss STDs or sexually transmitted diseases in the Philippines. What is STD, or sexually transmitted diseases? Sexually transmitted diseases are caused by bacteria, viruses or parasites that are transmitted through unprotected sex, vaginal, anal, or oral, and skin-to-skin genital contact. Zika virus can also be sexually transmitted. Bacterial infections include bacterial vaginosis, chlamydia, gonorrhea, lithogranuloma venereum, LGV, and syphilis. Viruses cause genital herpes, hepatitis B, human papillomavirus, HPV, and human immunodeficiency virus, HIV. Parasites are responsible for trichomoniasis and pubic lice. Travelers are at high risk of acquiring STDs if they have unprotected sex outside a monogamous relationship, engage in casual sex, or use the services of sex workers. During travel, some people may be less inclined to follow social mores dictating their behavior back home, and look for adventurous opportunities involving sex. Long-term travelers, expats may also be at increased risk due to feelings of loneliness or being homesick. Travelers should also be aware of sexual tourism and how it spreads STIs. Sexual tourism is travel for the procurement of sex abroad. Travelers participating in this type of exploitative tourism use the services of sex workers or children that are forced to engage in the trade, as a result of deceptive practices, or are a part of human trafficking networks. It's illegal in many countries, and you can be prosecuted in your home country for engaging in sexual exploitation of minors abroad. Sexual violence such as rape can also increase risk of acquiring STDs. Zika virus is present in Mexico, Central America, South America, the Caribbean, tropical areas of Southeast Asia including Philippines, Oceania, and parts of Africa. All travelers are at risk. Long-term travelers and aid or missionary workers going to areas where Zika virus is endemic are at greater risk. Zika virus is associated with neurological complications, Guillain-Barré syndrome, progressive muscle weakness that can lead to temporary paralysis, and microcephaly, decreased head size which may lead to developmental delays, in infants born to pregnant women infected with the virus. Real-time data on Zika virus outbreaks and transmission is often not available. This is because most people who become infected with Zika virus do not show signs or symptoms. In some countries, reliable reporting and monitoring systems that track virus transmission may not be available. As a result, it is not always possible to convey a country's current level of risk, but travelers should take precautions where risk exists. All travelers going to areas with Zika virus risk are advised to take mosquito bite precautions, particularly during the daytime. Pregnant women or couples considering pregnancy should consult a healthcare practitioner prior to travel. How alarming is sexually transmitted diseases in the Philippines? Sexually transmitted diseases, STDs, in the Philippines, particularly among expats, can be quite alarming. The country's vibrant and diverse culture attracts numerous foreigners who embrace its beauty and allure. However, amidst the enchantment lies a lurking threat in the form of STDs. Expats may find themselves susceptible to these infections due to factors such as language barriers, limited knowledge about local healthcare facilities, or engaging in risky behaviors while adapting to a new environment. Although this issue is not unique to expats alone, their unfamiliarity with local medical practices might exacerbate the situation further. It is essential for expats residing in the Philippines to prioritize their sexual health by seeking appropriate medical advice, and adopting preventive measures like using protection during intimate encounters. According to Makati Medical Center, here are the most common sexually transmitted diseases in the Philippines. Human papillomavirus, HPV. In the U.S., human papillomavirus is the most common sexually transmitted infection, People can get infected through vaginal, anal, and oral sex and skin-to-skin contact. There are over 100 different strains of HPV, and it can be passed on even when the infected does not show signs or symptoms. The disease can also cause genital warts and other types of warts. Anyone who is sexually active can get HPV, and it can develop years after having intercourse with someone infected. The best way to avoid it is by getting vaccinated, can start at age 11 or 12 years through 26, if not vaccinated yet. And using condoms every time for sexually active people. Being in a monogamous relationship can also help prevent catching the disease. Genital warts. Human papillomavirus infections cause the appearance of genital warts. These are fleshy growths that may form individually or in clusters. Lesions may also appear in the mouth or throat of those who have engaged in oral sex with an infected partner. Men who have genital warts can see the growths emerge on the scrotum, around the anus, on the shaft, and the tip of the penis. In women, it can pop up around the vaginal opening and spread to the rectal area and the cervix. These warts can be treated with laser and prescribed solutions and may require more than one type of treatment to disappear permanently. Using condoms and getting HPV vaccinations can help prevent genital warts. Genital herpes. Genital herpes is a contagious infection that can spread through sex. This viral sexually transmitted disease, STD, comes in two forms: HSV1 and HSV2. HSV1 is linked with cold sores, while HSV2 is associated with genital sores. It's possible to pass on herpes from the mouth to the genitals and vice versa. The blister-like sores can be treated with oral and topical medications. To prevent catching and spreading genital herpes, sexually active people must use condoms. Limit the number of partners, and get tested regularly. Syphilis. Syphilis is an infection that can have severe health complications, affecting vital organs like the heart, spine, and brain if left untreated. The symptoms of syphilis are divided into stages. Primary, firm and round sores called chancre at the initial site of infection, usually around the genitals, anus, rectum, or in and around the mouth. Secondary, involves skin rashes, swollen lymph nodes, and a fever. Tertiary, associated with severe medical problems. Treatment for syphilis includes antibiotics. However, the damage done might not be reversed. To decrease the chances of contracting syphilis, use latex condoms properly during intercourse to prevent direct contact with a sore. Syphilis is curable with the right antibiotics from your healthcare provider. However, treatment might not undo any damage the infection can cause. Having syphilis once does not protect you from getting it again. Even after successful treatment, you can get syphilis again. Only laboratory tests can confirm whether you have syphilis. Follow-up testing by your healthcare provider is necessary to make sure your treatment was successful. HIV/AIDS. The country's growing HIV epidemic has been fueled by a legal and policy environment hostile to evidence-based policies and interventions proven to help prevent HIV transmission. Such restrictions are found in national, provincial, and local government policies, and are compounded by the long-standing resistance of the Roman Catholic Church to sexual health education and condom use. Children may be particularly vulnerable to HIV due to inadequate sex education in schools, and misguided policies requiring parental consent for those under 18 to purchase condoms or access HIV testing. The human immunodeficiency virus, HIV, is directly associated with acquired immunodeficiency syndrome, AIDS. Untreated HIV can progress to AIDS. HIV is transmitted through semen, vaginal fluids, and blood but can also be acquired through sharing of needles, from tattoo piercing and blood or drug transfusions. The common symptoms of HIV include fever, chills, headaches, sore throat, swollen lymph nodes, mouth ulcers, weight loss, and fatigue. However, many patients experience no symptoms. There is no vaccine for HIV and no cure for AIDS, yet. But the spread of the virus can be prevented. For people with HIV, taking antiretroviral medication can prevent their partners from becoming infected. Taking post-exposure prophylaxis, PEP, within 72 hours can also reduce infection risk. For those who believe they have been exposed to it, more importantly, using a condom during intercourse can avoid transmission. Gonorrhea. Gonorrhea is acquired from having sex with someone infected with the bacteria causing it. Symptoms include feeling a burning sensation when peeing, swollen testicles, for men. White, yellow, or green discharge from the penis or more vaginal discharge than usual, and pain when having sex. This disease can be treated with antibiotics, which can also be given to the patient's sexual partner. Failure to get treatment for gonorrhea can increase the risk of acquiring or transmitting HIV. Through activated immune cells caused by inflammation, the spread of infection to other parts of the body, and infertility. To avoid gonorrhea, abstain from any type of sexual intercourse. Chlamydia. This is one of the most common and curable sexually transmitted diseases. Usually, chlamydia shows no symptoms, but those infected notice an unusual discharge and burning sensation during urination. Chlamydia can be treated with antibiotics. But since it does not show symptoms, getting screened is essential for prevention and diagnosis. Condoms are effective in preventing this disease. Sexually transmitted infections affect both men and women and can be acquired when an individual is exposed through sex with an infected partner. It is crucial for sexually active people to get regular screening for STI prevention and detection. According to a study, the most common STD here in the Philippines is gonorrhea, particularly among Filipino sex workers. It is essential for expats to educate themselves about safe sex practices while living in the Philippines. And take proactive measures like regular checkups or seeking medical advice when needed. Understanding the gravity of STDs in the Philippines can foster a safer environment for all individuals inhabiting this beautiful nation. Expats living in the Philippines should remain vigilant and well informed about safe practices to protect themselves from these infections. When it comes to building a meaningful and fulfilling relationship, expats residing in the beautiful land of the Philippines are often drawn towards finding a loyal partner. A calm demeanor enables expats to approach this topic with rationality rather than panic or undue stress, leading them towards responsible choices when it comes to their sexual health while enjoying all that the Philippines has to offer.
I got more to come on this subject. I tried to do a lot of research on the numbers, and they're not out there. I found that really hard to believe. So they get all the data that's out there seems to be very old. 2005. The latest ones were from Wise Voter, were the numbers I gave you earlier, and those were as of 2023 from the United Nations. For some reason, nobody likes to report these numbers. I promise to get back to you on that and stay up on this topic. Hope you enjoyed it. Please like, subscribe, and hit that bell for future videos. Talk to you soon. Thank you.